Today, we explore Scleranthus, a remedy that is quiet, subtle, and therefore frequently overlooked. Although placed in the uncertainty group, Scleranthus does not present with anxiety or fear. Its uncertainty is structural, not emotional. To understand this remedy properly, we must shift from surface descriptions to the inner dynamics. A state of inner imbalance where the vital force cannot find a center and therefore oscillates between two equally weight poles. This sentence is not poetic decoration, it is diagnostic. The keywords are cannot find a center. In Scleranthus, the vital force lacks an internal point of reference. As a result, the organism oscillates. Everything, mental, emotional, physical, follows this same pattern. This distinction protects us from misprescription. Scleranthus is not confusion like we see in anxiety states, nor is it emotional conflict as seen in grief or trauma remedies. There is no inner fight, only instability. The problem is not too many thoughts, it is the absence of gravity. Nothing pulls strongly enough to allow settling. This is why advice, reassurance, or reasoning rarely helps these patients. Scleranthus indecision is often misunderstood as weakness. In reality, it is a failure of equilibrium. Both choices feel equally correct and equally incomplete. These phrases, like 1 minute this, next minute that, I keep changing, I can't settle, should immediately alert the physician. Notice the absence of anxiety words. There is no I am afraid, only I keep changing. This is a structural disturbance of the mind, similar to how some remedies represent structural weakness of organs. That is why Scleranthus sits so comfortably in Sura. Ignatia is torn. Scleranthus is neutral. Ignatia suffers emotionally. Scleranthus does not suffer, it oscillates. Confusing these two leads to repeated remedy failure. Lycopodium hesitates because of anticipated failure. Scleranthus hesitates even when failure is not imagined. This absence of fear is a key diagnostic separator. Pulsatilla's decisions change because people change around them. Scleranthus changes even in isolation. Kent helps us locate the disturbance. There is no rebellion of will here, no passion, no force. The disturbance lies in understanding, the faculty that concludes and integrates. This sentence alone can guide correctly, prescribing when used carefully. This is polarity without struggle, like a pendulum that keeps moving because it cannot stop at center. Scleranthus can be understood as a rhythm remedy. Homeostasis fails not due to force but due to lack of stabilization. These patients often go unnoticed because they do not disturb others. No collapse, no drama, no complaint, only inner wobble. The body mirrors the mind. Alternation is the key, not intensity. Consider an adult who makes decisions easily, yet feels no peace afterwards. They revise, reverse, reconsider, not because of fear, but because certainty never arrives. This is classic scleranthus. In children, scleranthus appears as constant switching, toys, food, activities, without emotional disturbance. This is often mislabeled as distraction. There is no destruction here, only incomplete adaptation. The world is not chaotic, orientation is missing. This is for conceptual guiding only, not mechanical prescribing. After scleranthus, patients don't become decisive, they become settled. Decisions follow naturally. This single question can change case outcomes. Bach flower remedies should always be used under professional guidance and do not replace medical or psychological care. Thank you.